video, I will show you how we use these calipers, for example, on low back. Patient comes in with back pain. Based on how they filled in the body chart, we may have an idea, there may be a plasticity issue here. So what do? We use a 2-point discriminator to measure for the mapping sharpness in this patient with low back pain. In this session, we're going to talk a little bit about 2-point discrimination. We have mentioned that 2-point discrimination can be the best way for a clinician to figure out issues with brain plasticity. In a real clinic, we don't have the functional MRIs, but 2-point discrimination can give us a snapshot of what occurs in the brain related to body parts. The 2-point discrimination norms are set. We often will use the information from Catley's study, and this you will find also on the information site on our website. We're going to do 2-point discrimination in this case for a patient with low back pain. If you look at the normative data, there are numbers, and again, there's a standard deviation. We use these simple little calipers. They're not that expensive. We strongly recommend they have sharper points and that they are plastic. The metal ones seem to also interfere a little bit with the normal sensation. If you look at the normative values for people with low back pain, we can see the normative value is around 5.5 centimeters. We have a couple of options. We can take the caliper and start at 0 and work our way slowly out. The problem is it will take quite a bit of time. That's what's so nice about the normative values. In this case, we're going to take the little sliding scale and move it to about 5.5 centimeters, which is what our normative value is. And we will start here. Depending on Heather's reply, we will then move the calipers closer or further apart to establish what's normal in her case. For our patients in the clinic, we have already gone ahead and we've taken the calipers, we have made them familiar with the sensation so they know what they can feel on their hands, just so they can see it and feel it, and she understands what we're going to be doing on her low back. In this case, we made a little mark in her spine adjacent on the level that she will be experiencing low back pain, and we want to test it on that level. So in this case, Heather, we are going to go ahead and apply some pressure like I showed you on your hand, and you're going to have to tell me if you feel 1 point or 2 points. And we're going to start on the right side of your low back. In this case, Heather's left side is the affected side. She's experiencing pain on this side. We'll start on the uninvolved side to get her familiar with it, but also get some normal data. So we're going to go ahead and then apply the 2-point caliper. 1 or 2 points?
2. 1. 1. 2. 2.
In this case, you can notice that she has a pretty good location of 5.5 centimeters. Typically, the patient would have to get at least 2 out of 3 correct for us to have a good established baseline. If she struggled, we would move the calipers further and further and further apart. Mostly, as shown us with chronic low back pain, the calipers can move as far as 10 centimeters apart before patients can pick it up as 1 or 2 points. We will now come to the other side, her involved side, where she has back pain, and also do the test. We're going to do it on the left side, Heather, and just let me know if it's 1 or 2 points.
2. 1. 1. 2. 2. 1. 2.
And in this case, her affected side has the same value as the other side. She would now have a 2-point discrimination value of 5.5 centimeters. The same thing again, if she had problems to discriminate it, we would move the calipers further apart. This gives us an immediate snapshot view of what is happening in the brain with the body chart. Try and correlate what we see here with the patient's body chart, and that will give us an idea. Do we need to focus on sensory discrimination techniques to sharpen the map in the back to help her ease her back pain?